All right. So as a plastic surgeon, before I go there, this is Dr. Kusuma from Suria Cosmetic Surgery. Hello, everybody. I forgot to introduce myself, but I wanted to talk today about scars. As a plastic surgeon, clearly doing cosmetic surgery on the face, eyes, nose, neck, etc., and breast, it's very important that incisions heal well, very, very well. Otherwise, it's hard to hide them on the face, etc., right? So we're extraordinarily confident that the scars are going to be invisible, essentially, and placed in places that you cannot see and find. But occasionally, you do have problems with incisions, no matter how good a job you do. And so I wanted to kind of talk about the various type of scars, okay? Most of the time, you want scars to be very, very thin, almost like a natural line in the face that we get with aging, that they're very flat to the touch and to the sight, or at least not even visible, and they're placed in places or locations where you can't even see them in a normal day-to-day interaction with anybody, right? That's an ideal scar that has pigment matching to the site. It is invisible. It falls in normal landmarks and creases. That is very flat and smooth, and you can't really even tell that there's a scar there. That's ideal. That's what you want. And that happens, and that's why we do face surgery all the time, where it's a highest value real estate on your body, where when you are out and about, right? Essentially, from aesthetic, at least an aesthetic physical perspective. And so that's what we want, and that's what we get most of the time, but not all the time. There are sometimes scars are not so good. Sometimes some parts of the scar become thick, and you can like a rope sometimes, right? And when that happens, there's typically not because something was done improperly or whatever. It could be because it was too tight in that location, or they had stitch reaction or inflammation, or they have a tendency to form thick scars. Whatever the case is, it could form thick scars. If that happens, you have to correct it. One simple thing that we do sometimes is to put some medication like an injection in there or a topical agent in there to thin it out. It could be a steroid, it could be something called 5-FU, it could be a topical agent that you can also apply to make it thinner and flatter and not feel so ropey, right? So that's one thing that can happen. It's not because something was done improperly, because almost always it's attributed to something bad. But in plastic surgeons' hands, 99% of the time, we take utmost care to close it as well as possible. But despite our best efforts, sometimes it happens, but you just have to take care of it. Usually it's not the entire incision, it's usually a part of an incision somewhere, pesky, and you just have to manage it. So if it's thick, you have to make it thin and flat, right? So the medications are used, and if the medications are not doing a good job, then you have to remove that segment, called a scar revision. Essentially, you remove it, cut it out, and you restitch it finally so that this part also heals properly. And that is a fairly common thing that's done in plastic surgery for various reasons, for trauma, for burn, for surgical, problems, etc. It's called scar revision. Okay, that's for thick scar. A bad pigmentation is also a problem sometimes. So in darker skin like mine, usually incisions look darker for a long period of time, and then they lighten up. When I was a child, I remember falling or something hit me on my cheek, and I had a linear line here for a long time. You could really see it because it was dark. But then as I grew older, it faded almost completely. And it depends on sun exposure, depends on the time of the life you're in, your hormones, and various things. But lighter skin tones, like an Irish person, for example, may get the scars to look pink for a while. Or the scar itself may have hypopigmentation where it looks just white, very white, even compared to their skin tone. And that's a different pigment. So it could be red, it could be dark, it could be pale. If the scar is pale, it essentially means that it lost pigment. Those scars are hard to correct because lasers don't increase or add color to a normal skin tone. Pale color essentially means that it's lost pigment, and that's hard to treat. But if it's in an area that's not visible, nobody even cares or even notices it. But if it's red or pink or dark, you notice it. In those cases, you can certainly do laser treatments, etc. By the way, for thick scars also, you can sometimes use lasers to correct it in here. But pigment is also something you can use lasers to. And you can make all of these nicer with lasers, and sometimes even with microneedling if necessary. But you have to use the right laser with the right depth, with the right setting, with the right energy, and all those things so that you're targeting exactly what you want to target. Because the treatment for everything is not the same, okay? The scars can widen. Like sometimes, ideally we want a thin scar, but sometimes because of tension or because of the skin is just very thin and fragile, it can widen because it's under tension or whatever, or because it's in a place where you constantly move, and there's many parts of the body that constantly move, right? So that force of the movement near the scar bearing area constantly is under that force to keep moving and holding it together. So at some point it gives, it's almost like like an underwear where the elastic band gets loose, it just gets loose after some time, and that can happen to skin in general, or it can happen to an incision also where it kind of widens. And if that happens, usually, lasers can't help that too much. Steroids can't help that too much. Actually, it may make it worse. Lasers may help it where you can cause some contraction of that site, but it's going to be a long process where you have to do it 1, 2, 3, 4, 5 times to get it to kind of tighten up. But, steroids definitely don't help. And if it's pigmented on top of that, lasers may help there too. But in this case also, sometimes you have to do scar revision where you just remove the width of that scar and recreate the thin line in the hopes that it's going to stay much, much closer together like a thin line. And if it's really bad, in some cases it becomes a keloid. Keloid is a real condition. Keloid is almost like cancer, but not cancer, right? Cancer essentially is like, the body going crazy, like the cells just continue to multiply. They don't respect any borders. They don't respect any boundaries or any rules that the body has laid out. They just kind of go crazy. Obviously, cancer can kill you, but keloid acts like a cancer, but it doesn't kill you because it just locally goes crazy. The collagen fibers that are laid are very disjointed. They get thick. They get all kinds of issues, and glands of the skin get involved, and you get itchy, and it could be, it could be painful in some cases, and they're big, thick, and ropey like, and they grow like mushrooms sometimes. And that is a very inflammatory process that happens in the body's scars. And this can be triggered by anything. It could be triggered by an ingrown hair. It could be triggered by a cut or a nick. It could be triggered by surgery. Any of those things can cause it. And that's a very difficult thing to treat. Keloids generally can be treated, with steroids again, injections of steroids. They can be treated with keloid surgery where you remove the keloid. Sometimes you need radiation to it. To treat it. Sometimes you need compression to it constantly to treat it. So there's many things that can be done, but it's a very, very recalcitrant problem that needs ongoing effort to kind of manage it. And you may have seen it. People get it in the earlobe from just an ear piercing. So that's another type of problem that scars can get, which is the worst kind, which is to get a keloid. So these are the different type of problems that can happen with scars, but all of them have solutions. And a good plastic surgeon should be able to help you with any of these, even if the surgeon themselves did the surgery and has a segment that's a pesky nuisance. You still have to manage and take care of it. So please understand that there's many types of problems that scars can have, but not often, because that's why we do so much plastic surgery, because most of the time it doesn't cause a problem. But when it does, there's solutions. So don't worry about it. Talk to your surgeon and they can help you.